It's hard to ascribe the actual participation of this drug and the availability of this drug in terms of helping people quit smoking overall. So the data is unclear as to the role specifically of Chantix being able to reduce the population's, the rate of smoking in the U.S. But what we do know is that it's an effective agent, that it is actually effective in patients with and without a psychiatric illness. And we know that patients continue to smoke, have difficulty quitting, and having Chantix available to them is an option that is important for helping people quit smoking. The drug has been on the market now for 10 years. It was first approved in 2006. So this is the 10th anniversary of having varenicline available, not only in the US, but also in almost 100 countries worldwide. And what we've seen originally is that there was a great uptake of the utilization of the medication when it was first approved. There's clearly an unmet demand in terms of people wanting to quit and not having available to them effective medications. And what we saw after the initial uptake, when they were starting to have these reports, these post-marketing reports of serious neuropsychiatric adverse events, that the utilization did decrease over time. A big part of that was there wasn't enough evidence available to answer the question that the FDA asked us, which is are these reports related to the drug or not? So there's been a lot of information that's come out since the label change with the inclusion of a box warning. There's a lot of evidence, both in terms of meta-analyses, large observational studies, and now the EAGLES trial, that actually all point in the same direction, that these kinds of events that have been reported are not likely due to the drug. So what we do hope to communicate to people that still have potential reservations of using the medication is that the EAGLES trial should help them understand what data is available in a large, well-controlled study where you're looking at not only varenicline, but bupropion and nicotine patch and placebo, and seeing that there are no significant increases in neuropsychiatric adverse events, no significant increases. This is an important piece of information, I think, that both physicians and smokers will have when looking for what's the right kind of treatment for them. From Pfizer's perspective, we certainly want to play our role in terms of helping with regards to this terrible problem. This is a real public health problem of smoking. It's the #1 preventable cause of mortality and morbidity. And our role is really to help with the discovery and making available new medications. And with Chantix, this was a drug that was specifically designed to help people who want to quit smoking. It's a different mechanism than nicotine. It's a different mechanism than bupropion has. And in fact, what it does is it blocks nicotine from binding to the receptor, and it also helps with relieving craving and urges. And so it's important to have available across a lot of different policies that are out there to help people quit smoking, whether it's governments raising taxes on cigarettes, whether it's preventing any kind of advertising, but it's also around medications and treatments. We know from treatment guidelines that the optimal way to quit smoking is to use medications with behavioral support. And so from our perspective, from Pfizer's perspective, we want to at least provide effective medications to help people when they're looking for assistance in helping them quit smoking. Well, I think one of the things that's really important to keep in mind is that smoking does kill. It kills half the people that continue to smoke. And people don't recognize or appreciate the fact that in the U.S., there's more than 480,000 people that die every single year. That's 480,000 people that are dying due to smoking-related illness. And so it's not something that's been conquered. There's still more than 40 million people in the U.S. that are smoking. We know that it has serious health consequences, but it also has economic consequences. And people should appreciate that it's very difficult for many people to quit smoking, and having available to them pharmacologic treatments, it's important to have these treatments available to them to help them quit smoking, because it's an important thing that they can do for their own health, is to be able to quit smoking. For Pfizer, we certainly have an interest in the tobacco dependence policy in terms of developing medications. And what we look forward to in terms of this drug, varenicline, we do continue, as with all our medications, to continue doing studies to further characterize and understand the medication. What we've shown with this drug, we've extended the patient populations that have been studied. In the past, we've looked at populations of smokers that have cardiovascular disease that's due, in fact, to their smoking. We've looked at patients that have COPD, which is respiratory disease. These are people that smoke, and their disease is related to their smoking. So it's important to understand these different subpopulations of smokers, and we will continue to look at that and understand how the drug works. And the evidence to date is that Chantix works well in all populations that have been studied to date: patients with major depressive disorder, psychiatric illness, COPD, cardiovascular disease. This drug does go off patent in a few years, but until then, it's important from our perspective to make sure that both physicians and smokers are aware of the characteristics and the information that's available around Chantix, so that they can make an informed decision when looking for medications to help them quit smoking.